Two primary injections I can think of. One costs $526.72 a month. The other one anywhere from $300 to $1,700. Could you imagine trying to tell somebody out of pocket, I'm sorry, your charge is $756? I mean, they'd tell me where to go, right? And then our job is to just sort of reassure them, it's okay. There is no out of pocket expense for you.
Hello and welcome to another episode of Bunny Hugs and Mental Health. I am your host, Todd Renabaum. I've got another really great episode for you here today, or this week, or right now, or this evening, whatever time of day you're listening to this. Now, I said at the last week that this week's episode was going to be with Elise Michaels. She's a men's mental health coach. That's actually going to be next week. So if you had high hopes for that, I apologize. That episode is coming and it's going to be next week. This week, it's actually with Lindsey Ziegler, and she is a pharmacist at Vital Care Pharmacy in Regina, Saskatchewan, and they specialize in mental health medications only, and addictions. But, for me, it's all the same. And she really knows her stuff. Her and her staff are amazing. And the pharmacy is actually located in a lower economic status kind of area of the city. So she's kind of a superhero for a lot of people. She deals with a lot of people, and she deals with a lot of doctors, and she's just, well, you'll hear all about it. As far as mental health advocates and people that are working in mental health, she's highly regarded and respected. And I'm just so happy that someone like her is doing this kind of work for people. So thank you, Lindsey. Next week is Elise Michaels. She's a men's mental health coach. And I know sometimes life coach or mental health coach, those terms get thrown around, I think, way too often. And I've spoken with quite a few, and there are some really great ones out there, and there's some really not great ones out there. So, it's a flooded market of coaches right now. So just be careful, do your research. I guarantee you Elise Michaels is a very good coach. Her specialty is men's mental health. So we're going to talk with her next week. Stay tuned to the podcast because there's going to be some new stuff coming up. I don't want to give too much away, and also I don't want to say too much just in case I don't actually follow through with it. So, but please stick around. There's going to be some exciting stuff coming up in the future. It's going to take some time, but by Christmas, hopefully more stuff. If you'll see. And if you end up enjoying this episode, or if you've enjoyed past episodes, please rate and review the podcast, and please share it, either word of mouth or via social media. And it would be very, very much appreciated. And I think there's a lot of people out there that could really benefit from hearing something that my guests are saying. But anyway, without further ado, I give you Lindsey Ziegler.
So I guess the inception of Vital Care Pharmacy happened in 2017 by a pharmacist named Melanie McLeod.
2017?
2017. We've been here since 2017. We've been here for a little while now.
Oh, okay.
She worked as a pharmacist through the health region at the outpatient mental health clinic and did a little bit on acute inpatient psychiatry. And throughout her professional journey, she sort of really recognized I guess where we were lacking in services for those living with mental health and substance use disorders within the community. She saw the gaps in care, and she knew how, as a pharmacist, she could work to fill some of those gaps. And in order to do that, I think she had to sort of step outside the box and do it herself and open a community pharmacy. So in saying that, I partnered with her and teamed up with her before sort of the inception of the pharmacy and before we opened. And we opened in March of 2017, the end of March of 2017, and have just sort of really tailored the focus and our practice environment to people living with mental health disorders. And in saying that, we're jack of all trades. We just happen to be niche focused and really care about people living with substance use disorders and mental health. So that's sort of how it all came about, and here we are today.
Awesome. I appreciate your service because, I'm I too am on medication, and I've gone through substance abuse and stuff. And I don't know if you know anything about me at all. I have no idea, but well, I'm Todd. And I've been sober 6 years. I've been in and out of the psych ward after suicide attempts and stuff like that. And I've been advocating for about 6 years, and I'm feeling much better now. Oh, and things have super elevated my life about 4 months ago when I was diagnosed with ADHD. So it's like, oh, that's why all this stuff. But anyway.
Missing piece of the puzzle, I guess, in your personal journey, right? And I guess once that sort of was diagnosed and you start treatment and you sort of recognize what life is like, being able to sort of live with your ADHD, but being treated with your ADHD probably made the world a difference for you.
110%. Yes, it's been amazing. I'm not cured or anything, but I can use the right strategies. I can not justify, maybe that's not the right word, but I can logically think about why I'm feeling when I'm feeling it and not just freak out.
It's having insight, I guess, right? And I think a lot of that is missing before, but it sounds like you have really good insight. And so it's really powerful to watch people who, when they become treated or they get treated for their illness, have that insight, realize it's not them, and then watch them throughout their journey and their journey to recovery, and not necessarily cured, because we're not curing anything, but we're learning to live with it, and we're learning to sort of understand it, and to watch that journey is really powerful for people, and for myself included.
Do you see the transformation in clients when they come in from their first prescription to, months later?
It is remarkable. And I think this is why I'm really passionate about mental health and following clients living with mental health. So when you see people come out of, unfortunately, the psych ward, for a lot of people, it's a very traumatic experience. And I don't know if there's a lot of just maybe family stigma or the stigma that's associated with the psych ward, and I'll use that term in quotations, but they come out, they're really defeated, treating an acute episode of psychosis or an episode of mania in somebody living with bipolar. We essentially plow on a bunch of medications for these people, and it really dulls them and it flattens them, and they come out sad and defeated, and they really just don't even know where to go. They're not working. The family dynamics are all in turmoil. The family doesn't know how to sort of help this person navigate their journey either. And everybody is in sort of disarray. And I don't know why it is so difficult or different than people, for example, who had maybe a heart attack or a stroke. Maybe we just look at that from a different lens. But people come out defeated, and then over time we take away medications, we adjust medication regimens, we get them feeling back to their baseline, they start working again, their family relationships start to change, people become happier, and it's so inspiring to see, and just to see somebody get back on track and to have that positive outlook on life again, and that maybe they did have that episode of suicidality which put them into hospital, and for them to be open and to have that conversation to say, you know what, I don't feel like that anymore. Like, I've had people, I guess, come up to me and be like, this weekend, a couple of weekends ago, a client came to me and how are you doing? And it's like, well, today I actually took my shotgun out and tried to figure out a way how I could use my shotgun, pulling the trigger with my toes, right? In order to be able to end their life. And it's to have these discussions and to watch that journey and to watch the medications and the lifestyle measures really just sort of pull them out of this dark place. It's just so powerful.
Yeah, I used to work in Pine Lodge. I was a client there, and then I ended up being on staff. And yeah, even in a month's time, when you get to see their journey of healing, it's incredible. And it feels, it feels good that you have a purpose and you're helping people. But the problem with Pine Lodge is it's 30 days, and then they're off to who knows what happens after that. But it's great that you get to you must have clients right from the very beginning, from 2017, that you're still seeing.
We do. We're really fortunate, I guess, and I guess like a lot of other pharmacies, you build that rapport with that client, and they're sort of a lifer with you. And I've had people like, Lindsey, you've saved my life, right? And it's not even that I've really done anything, but it's just I've supported that person in their journey, and they're there and they trust you, and that rapport is built, and we communicate with the physicians on their behalf. And just the relationship that we have in a multidisciplinary and very collaborative fashion really encourages that patient to sort of stick with the pharmacy and stick with their care providers, because we are part of the team, and we just get to watch their journey. And it's nice when you get to know these people, because early intervention is key for people who might be destabilizing in their journey. So if they are living with schizophrenia or bipolar and they're starting to experience maybe a little bit of psychosis or a little bit of an elevation in the context of mania, or they're starting to become depressed again, they'll tell you, and they see us much more frequently or have access to us much more frequently than their primary healthcare provider, which, I mean, in Saskatchewan and across Canada these days doesn't exist. Primary care providers are a hot commodity, or their psychiatrist, which could be, coming out of the hospital, maybe an 8-month wait list. So they see us, and then we can just reach a physician or a care provider right away, make changes, and prevent that patient from going into hospital. And it saves the hospital lots of money. It provides a lot of relief to that patient, comfort that they're not going to be admitted. We can keep them in the community, at home, feeling good, getting them well faster and stronger. And so that's wonderful.
I relate to all of that as the client. It was probably 10 years ago when I was in the psych ward, but it was scary. I had no idea what the hell was going on. I was already on meds, but they changed my meds when I went to the hospital. I mean, people ask me to this day how to navigate the mental health system, and I'm like, I don't know. It's tough. Like, I don't really know. So to have someone like you who not just, dispenses meds and gives advice about medication, but to actually be a liaison between the client and the doctor somewhat, and to help them guide the system, it's amazing. I wish I knew about you. Well, I guess you weren't around then, but I wish you were around when I was coming out of the hospital, because you're worth your weight in gold.
Oh, thank you. Thank you. Yeah, I can't imagine for certain particular clients, especially like just being so acutely unwell, not being able to like focus or concentrate. It's just, you don't have the capacity at that particular time to, sometimes unfortunately even shower and take care of your basic needs, let alone trying to navigate a system that's not meant to be easily navigated. And so part of the inception of the pharmacy, we integrated it in our workflow, allows us the opportunity to navigate the system for patients. So most community pharmacies, like Shoppers or, some of those grocery store pharmacies, they're so busy. That's the sheer nature of the business. But trying to now then turn around and integrate all of this like administrative work and waiting on hold at the drug plan into somebody's workflow is very challenging. And so because we've started with that piece of the puzzle and we've integrated it into our workflow, it's then helping that client, I guess, navigate the financial barriers that come across with medications. You had a job and now you don't have a job, and now your meds are costing $80 a month, and when you're not working and you don't have food, or you don't have transport, or you don't have basic needs, well, what makes us think that somebody's gonna have the means to pay for prescriptions? So it's just knowing the nuances that are within the government, so to speak, and knowing who to call in order to help make that transition for that client that much easier. And if you can get people to stay on their meds, that's going to obviously foster and facilitate mental wellness much faster. But if people can't pay for their meds, they're not going to take them, and then it's just going to be this vicious cycle. So integrating that in our workflow, I think, has been sort of something that really makes us unique.
That's awesome. Yeah. I know when I was in my darkest days and coming out of the hospital and stuff, and I had to go back to work when I shouldn't have gone back to work, because I didn't have the capacity to fill out paperwork to get like disability, whether it was short-term or long-term. Like, I mean, I get anxiety just writing my address, like trying to do paperwork, government paperwork, like forget about it. So I just had to go back to work, and I wasn't ready. And then, I just got sick again, and it was brutal. So yeah, that's amazing that you're helping people financially pay for the meds as well. So those things are kind of tied in together there.
They are. They really are. And it's really sad, and it's really too bad that money plays such a driving role in pharmacy as a business, but that's sort of the reality that we face. So it's just navigating it in whatever capacity we can. And if I didn't have to touch a dollar or didn't have to touch a cash register, I wouldn't. But unfortunately, that's not the nature of the beast, right? And filling out paperwork, if I could hire a social worker and just have them on staff and have them facilitate that paperwork and housing applications and all that type of stuff, I would. But again, that's not sort of my reality. But the nice thing is I now know where to go for that help. And I've made it a point to collaborate a lot with these other allied healthcare providers, and we just work as a team for these people, which has been really rewarding.
Okay. Do you have a psych nurse on staff, though?
I have two, which has been really nice. Part-time. So I have one on Tuesday, Wednesday, Thursdays, 10 till 5. They're registered psychiatric nurses. I think combined total like 70 odd years of experience. Like one's 42 years and one's 30, maybe close to 40 years. They're retired from their work through the health region, and they help me. We administer a lot of injections, long-acting antipsychotic injections, and a bunch of other different types, maybe hormone replacement therapy for the LGBTQ plus population of people, and a bunch of other ones. So they help me just from an administrative capacity. I needed them. I couldn't do what I needed to do as a pharmacist because I now have about 250 clients that come here for their injections. So they have been a lifesaver. They know a lot of their patients. They know them from when they worked within the health region as a nurse on the acute inpatient psychiatry or as case managers out at the mental health clinic here in Regina. So they know the people, they know the early signs and symptoms to watch out for, and somebody that's destabilizing. They help me administer injections. We monitor blood pressure, do scales. Scales are sort of a tool that we use to see how, well or unwell somebody is. In the context, maybe monitoring for side effects too. We use different scales and provide early intervention, but they have just been a bit of a godsend, really. They are invaluable.
That's incredible that you're able to have people like that on staff. I mean, what was it, like 6 or 7 years ago when I started advocating? It was because the health region were getting rid of, I think it was 12 psych nurses in Regina, and it was, I'm like, what? How? Anyway, I won't get into that story, but it's incredible that you're able to have them on staff. For addictions, what do you, what's it called? I can never remember the name of the drink.
Methadone.
Yes. Do you have methadone and Suboxone and
Sublocade? Have you heard of Sublocade?
I don't know.
So Sublocade is an injectable version of Suboxone. So it's really, really nice because people don't actually have to come and present every day or witness these medications in the dispensary and then come back. Sometimes it's witness one and they can take 6 doses home, but it's a once monthly injection subcutaneously into their abdomen, and then it carries them and helps them manage within the community and keeps them, I guess, more stable. And it's more convenient. So people are more likely then to engage in therapy because they don't have to show up every day. And if they miss X number of days, then, oh, sorry, we got to start from scratch. And it's just, again, this whole ordeal. If somebody doesn't have their basic needs met, phone, housing, food, what makes them going to show up for their meds and stay stable? It's just like very complex, but this is just another tool in the toolbox, so to speak, to help somebody engage in care. And it's awesome to see.
Is it a fairly new medication?
It's been around for a while, but it's been within the last couple of years that our drug, like the Saskatchewan formulary, so the formulary listing for medications covered for people who are just don't have any, I guess, other financial support. It used to be something called exception drug status criteria. So essentially everybody meets criteria for coverage. And within the last couple of years, it's become, I would say, more readily available and such a increase in uptake because the providers are really jumping on board too, and patients are really starting to see the benefit. So yes, methadone, Suboxone, Sublocade, all of that.
Do you think that the government has kind of changed the rules to let that drug in because of the record-breaking drug overdoses we're seeing in the province over the, like, what has it been, the last 3 years? We keep breaking the records every year.
I think you're right with that. That's a sad record that we're breaking, but yeah, I think that they had to, or were sort of forced to recognize what's happening and really sort of pull all resources and all options for patients. And it would be really doing them a disservice to not have it.
Not all options.
True, not all options, but more options than we had before.
Right. Safe injection sites they still refuse to recognize.
Saskatoon has one though, right? Don't they? They have one?
They do, but they're not. The government doesn't give them any funding.
They get fundraising money. Yeah,
it's all donations. Which I have a episode coming up with the director of Prairie Harm Reduction coming up, so I won't get into that. Yeah. Well, actually, I mean, I don't know how specific you want to get, but what are your thoughts on the mental health system in the province? And I'm guessing you think it needs work, otherwise you wouldn't start a pharmacy specifically for mental health issues.
For sure. I have a lot of issues with a lot of different aspects of mental health and how, I want to say it's funded maybe, but caveat, I don't know a lot about funding, but we get these memos in the budget every year and it's like, $80 million is going to be given to mental health. And I'm like, oh, this is amazing. Finally, they're recognizing the need. And I don't even know where it goes, you know. And I think I've emailed some directors under my umbrella before. And I was like, I see there's $80 million in mental health. Would love to see, you know, pharmacists specializing in mental health go here. This is where I think we could do something really amazing. And it's like, oh, sorry, like, no, the power's beyond me say no type of idea. And here in Saskatchewan and here in Regina, so we're obviously a unique entity. So we do our own thing and we're not remunerated by the government at all for any type of services that we provide, injections, etc. It's all out of pocket, part of our model in how we provide care, but it's not a financially feasible model. And I see why nobody else would want to take this on. Like, from a business perspective, they're not going to be able to feed their families on a model like this per se. And then within the health region, well, we have one pharmacist full-time who works outpatient mental health and then acute inpatient psychiatry. And there's something like 50 or 60 inpatient beds, plus maybe 10 to 15 adolescent unit beds. She's not there full time, but in Saskatoon, there's like 2 or 3 full-time pharmacists. And I just think, like, how did we get so divided? Why is there such a disparity between sites, right? How we have the federal penitentiary in PA and we don't have any support up there. But then we talk about forensic psychiatry in the whole context of corrections, and that's a totally different can of worms, and that system is broken. And even to allow, I just speak from mental health in a pharmacy context, to just every day I think I would do such good things. If you put me in that jail, I think I could make a vast difference in the lives of some of the inmates and help with policy change and just things that work. But the reality is, I guess, the funding that we got or wherever it is not meant for that. So I don't really know if government truly understands like grassroots level mental health. I mean, the politicians out there, do you really know people that are living actively with substance use disorder or acute mental health issues? Probably not. And I hate to say that, but the reality is people just don't get it unless you're on the forefront.
So you don't think it's very good?
Wah wah. Terrible.
Yes. So I've spoke with the Minister of Mental Health a few times, and I was invited to the legislature before and to talk mental health and stuff. And I find, oh boy, okay, I hate getting into politics, but you know what? Fuck it. So it's a lot of times when they're like $80 million more, and it's like, oh, but 75 of that million was actually from the feds. So then the province like pats their back that they're putting this much more money in. I've noticed that. I've also noticed that they don't care what they don't like being consulted, or maybe they like being consulted, but they don't listen to the consultants like yourself and directors of prairie harm reduction and psychiatrists and, even like the U of S Department of Medicine and stuff. So I don't know if it's ideology or what it is that gets in the way. Yeah, I don't know what the hell it is. I think they have their priorities, and they, especially when it comes to addictions, it's like, here's a few more beds, cram them into your treatment center, but we won't offer more training to get more counselors, because if you want to get training, you have to go to PA. It's a 4-year course. So they keep, oh man, I'm going bananas.
Breathe.
So they give you more beds. They don't give you the option to find more staff, and then they don't offer any kind of harm reduction, anything. So it's like, well, if you didn't die, then you get treatment. It's like, well, okay, how about some prevention, oh man, I could go on and on and on.
Well, I don't think that they realize.
Why did I ask that question?
They don't realize either that, like, somebody who actively uses crystal meth, for that rewiring of the brain, it literally takes somewhere between 6 to 8 months for baseline to return. And baseline with a little bit of probably prolonged permanent impairment, unfortunately, for a lot of people. And so to think like, yeah, here's your 1 month like inpatient treatment, I mean, it does nothing. And so
yeah,
sad.
And the thing I noticed when I worked in addictions was a lot of people, when they were in the throes of their addiction, they also experienced a lot of trauma. And, people are always, oh, it's their choice that they took the drug and this, well, I mean, people cope in different ways, right? So no one's shaming and putting people in jail for having an eating addiction or going to the gym 3 times a day because that's how they cope. I didn't mean to make this all about addictions.
That's okay. It ties hand in hand with people living with mental health, right? So, I mean,
Absolutely.
Essentially you don't really have one without the other, unfortunately, in this day and age, or it's not very common that you just have one as a single entity.
I agree. Yeah, it even bothers me that we have to say mental health and addictions. We should just say mental health because, yeah, it's the same
Addiction
thing.
falls under the mental health portfolio, so.
Yeah, absolutely. One question I was going to ask, so you actually even help people get off of medication. So this is how I heard of you. Was at one point I was wanting to go off my fixer, and the doctor prescribed me half and then half again. The withdrawal was so fucking bananas that I just went back on it. And I heard that you will actually you will fractionally make it even smaller and smaller, so you can really wean yourself off and not have these big chunks of missing medication.
The reality is, well, first of all, with a fixer, that is probably hands down the hardest antidepressant, anti-anxiety med to come off of. Just talking to people and talking to my clients, it's a really terrible experience. So we do our best to absolutely support that person coming off of it. And sometimes the reality is, no matter how slow we go and whatever we do to try to mitigate those withdrawal, it's going to happen, but it's providing options to make you comfortable. So nausea, vomiting, headaches, fever, chills, people describe brain zaps, fogginess. It's just teaching people what to do short term, knowing that it will probably be short term to comfortably get through that until they're off of it. And a lot of the time that gets missed too. And then, like you say, you just go back on it because it is so unbearable that we just go back on it and we stay on it, and then we're on unnecessary drugs and unnecessary medications, which is not okay either.
Yeah. Yeah, I've often wondered so now that I've been diagnosed with ADHD and I'm on Concerta, I'm doing, I'm actually treating the cause, not the symptoms, if I could someday go off my fixer. Because the last time I tried to go off it was probably 4 years ago, and it was such a nightmare that I might be taking a medication for long term that I don't need anymore, and I'm just scared to go off it because I'm so physically addicted to it.
Yeah, the body does develop a dependence, but it's just, again, finding the relationship with your care providers, getting educated about that experience and that drug, and just developing a unique, specific to yourself, for example, a specific plan for you, and regular touch base points to come off of that. Okay, we'll start by reducing 37.5 milligrams. We'll ride there for a couple of weeks. How are you feeling? What has been happening over the last week? Okay, well, you've been experiencing X, Y, and Z. Okay, well, let's manage that, get you feeling well again, and then we'll know what to expect when we drop again. And this is how you'll handle it if it happens to make you feel better. In order, just till you're done. And it might take months. It can take months to come off of drugs. But, who cares, right? As long as you're feeling good. Slow and steady wins the race, I guess, right?
Yeah, I don't mind it if it takes a long time. To be honest with you, I trust you. We've been talking for 20 minutes. I trust you more than my psychiatrist, who I've had for 10 years. Because he's like, no, you have to be on these meds. And then I told him about my ADHD and stuff. And he's like, this fixer does more than just that. And don't go off it. And I'm like, but...
Well, part of us as care providers is, providing you information of the risks and benefits, right? And so it's talking and, again, developing the care plan. But ultimately, as the client who goes to the pharmacy every month, picks up the prescription and chooses to tangibly take the pill out of the pill vial, put it in their mouth and swallow it, it's ultimately going to be your decision. So if one day you go, you know what, I want to do this and I want to see what it's like, our role as care providers is to not hand slap you, dictate decisions for you, but it's to support your journey. And let's try it. Let's do it in the most safe way possible and see what happens. And again, having those regular touch base points with the care provider that you've built that rapport with is what's going to make that journey successful or not. And an early sign of destabilization, or if you're like, you know what, shit, I don't feel good anymore. I'm starting to notice a change in my mood, a change in my anxiety, or X, Y, and Z. Then we stop and we go back up and we just sort of ride the wave for a while, and then we examine what's going on, right? So we have to support the patient. It's their choice. Yeah. Patient autonomy.
Yeah. Yeah, it's interesting. I also have a friend that's like, don't do it. But I don't know. I don't know what to do. God damn it. I don't know what to do.
Can't help you with that.
Tell me what to do, Lindsey.
Talk to your collaborative care providers who are under your umbrella, your psychiatrist, your pharmacist, and make a plan.
Okay.
Sorry, I can't be much more.
I know how that goes.
Yeah. If you're going to come off of it, do it slow. Find somebody who supports you. And ultimately, you got to do you, right?
Yeah. Yeah.
See what happens.
You know what? Cold turkey. That's what I'm going to do.
Probably not the best plan, just from experience. But in saying that, you and then 80% of the population of people who just stop their meds cold turkey, right? So this might feel really terrible.
Anyone that's listening that's thinking about going off their meds, do not do a cold turkey.
Do not do it. Horrible.
It's a nightmare. Yeah. I did that once. When I very first started medication, I was on it for maybe 6 months. I was like, okay, I'm feeling better. I don't need it anymore. And I stopped and woof. And it wasn't a fixer or something else. I don't know. I can't remember what it was. Paxil maybe or something. But yes, I've been told a fixer is the hardest one to come off of. And I was like, oh, good, great. This is awesome.
But it's a good drug. I don't want to scare people if you're on it. It's a good drug. And if it's working and it's the drug for you, we keep on keeping on, right? But it's just very challenging potentially for people to come off of it if it's not done in a way that's appropriate.
Right.
But it's a good drug.
Even if I'm like 3 hours late taking it, my day is shot. It feels like I'm hungover for the rest of the day. Yeah. You
could just be a sensitive soul too, right? Some people are just very sensitive to medications, right? So, and to notice a 3 hour or a couple of hour window where if you're late taking your meds and it affects the capacity for you to function and to feel well for the rest of the day. There are a lot of people that are just very sensitive to medications, and that's another reality too. But it's a good that people have insight to that, right? And now you just make sure you take your pill.
I am a sensitive soul.
Yeah.
Thank you.
You're welcome.
You seem sensitive too. Have you been on any of these meds before yourself?
No, fortunately, I have never been on any of these medications by myself. Well, caveat, I've used some Ativan, and that's a really nice drug. And it works in the capacity that it should.
And then some.
And then some, yeah. So I have used that before, but I've never had to be titrated up or tapered off of any of the medications to truly understand. It's just through patient stories and patient journeys and their descriptions to me and how I see them function and their conversations with them on the phone that I've seen the terribleness that can ensue. And we learn about it in school, I guess, but again, that's very didactic, no real life tangible experience to that. And you think, okay, yeah, in school, I get it, whatever, sure, we'll counsel patients on it. But no, it's a very real hell that somebody's living when they try to either come up and go on it and they don't tolerate it, because that is a different version of hell if you start a medication that you don't tolerate. And then when you come off of it, as equally terrible. So,
yeah, I mean, I like suicidal thoughts instantly.
Yeah.
Brain, like you said, the brain zaps. Like, I want you to experience a brain zap because it is fucking bizarre and awful. Mm-hmm. It's just like, I can't even explain what it feels like physically, but also just generally emotional. Like,
mm-hmm. Yeah.
I remember when I was going off and I was watching like America's Got Talent was on in the background and some 13-year-old girl was singing and I started bawling. I was like, it's so beautiful. And I was like, what am I doing? I've never cried. What the hell's going on here? It's wacky, man. Mm-hmm. So yeah, you can quote that. It's wacky, man. To your clients that are coming off. Now I'm going to flip-flop a bit. Back to that medication you were talking about for addictions, the monthly injection. Is that easier to come off of than it is I forget the drink again.
Methadone.
Yeah, is it easier to come off of than methadone? I've heard Suboxone is easier than methadone, but I don't know if that's true either.
Well, they're both really different, and they're prescribed sort of, I guess, the same but different. So the injection is nice. So from a long-acting injection perspective, anything that's long-acting is theoretically easier to come off of because it's slowly going to leave your body. It's not sort of something, if you have to take it every day, you get these what we call peaks. You take the medication, the drug levels go up. They last for 24 hours and then they come down and then they go up and then they come down. So when you miss that day, it's quite significant. So from an injection perspective or a long-acting medication, when it's up and elevated in your body, it just sort of stays consistent for a prolonged period of time and slowly comes down. So it's nicer in the context of weaning off of something, right? Because you're not going to notice maybe an acute or a very blunt, aggressive, hard stop of feeling ultimately really terrible. Methadone is also very long acting in the context of oral medications. I think it's about 5 days half-life, which is a lot of time. So what that means for people too, but it's tough. It's really tough because I'm not somebody that's living with the illness and I'm not somebody taking the medication, but people can miss a couple of days of that. And because it lasts so long and it has that long, what we call half-life, it stays in the system, they don't notice it as much as if they miss a day or two. But ultimately, they'll come down from that faster than they would an injection which lasts a month, if that makes sense. But we use methadone for people who use a lot of opioids or a lot of fentanyl. If we don't know how much somebody uses on the streets, because we can't necessarily know, okay, you use how many points of fentanyl plus X, Y, and Z. Well, we don't know what X, Y, and Z has in the context of being laced with any type of fentanyl or opioid. We will probably use methadone. Suboxone is more for people that we sort of can differentiate or determine how much opioids they use. And if they might not use as many opioids, we can use Suboxone or Sublocade more effectively because it's not, I don't know, methadone's, I guess, stronger, doesn't really have that ceiling, whereas Sublocade has a ceiling, meaning you can only use so much opioid before it becomes not as effective. Sublocade.
Have you considered using a bunch of opioids and then using methadone just so you know the experience, and then you'd be better at your job?
You know what? I think about this a lot, but now I'm a parent and now I have a 2-year-old. So I think now that these weekends, when I used to spend a lot, every Friday, Saturday night out on the Dudney strip back in the day, I might be a little bit more inclined to dabble in things. But in this day and age, as a parent now, I feel like I'm very limited in my extracurricular activities to be able to counsel patients on the true feeling or the true personalized experience, but maybe in another life. So now I just go by what my patients tell me.
That's fair. I mean, for research
purposes,
only, right?
Yeah.
Do you get a lot of people with ADHD? Like, is Concerta considered a mental illness?
Well, yeah. Attention deficit hyperactivity disorder falls under the DSM criteria for a mental health disorder. And you know what? We're seeing a lot more people get diagnosed in their adult years. It was very much the perception of old school thinking, maybe that it was more maybe just a childhood illness. People kind of grew out of it, that type of thing. But over the last several years, there's a lot more adult diagnoses, and it's game changers for people. Concerta's game changing for people. It's just sort of like, and caveat too, I mean, people may have been treated as children and then sort of stopped and sort of like gone through their early adolescence into early adulthood, maybe being able to cope, maybe not, but not really being able to express how they were feeling. And generally it sort of comes out in later adulthood, generally with comorbid other mental health disorders. We sort of start screening for that more, and there's a lot more adult diagnoses. And so Concerta is a hot commodity drug. It's a hot commodity drug, but it's also not cheap. It's another one of those that are not cheap.
Yes, you were talking about helping people financially with their medication. Just today, an hour ago or whatever, I was talking to my pharmacist. So a few weeks ago, I was talking to her, and I found out that I don't have a very good drug plan with my wife's job. I only work part-time because that's all I can handle. Otherwise, I shut down, which is a whole other story. But anyway, she said, "Oh, your drug plan is maxed out. Your meds are going to be $180 a month now." And I was like, "What?" Like, I already have anxiety issues. Like, now I was like, "What? I don't even how I can't afford this." And she's like, "I'm so sorry." But I got a 1-800 number, and I called it. And someone gave it to me, and they're like, "Here, call this number." They asked 4 questions. They are covering my medication for the next year.
So this is, again, something I think that where Vital Care comes into play is we are sort of like piranhas on the drug coverage front. So anything, for example, that has a brand name product, so Concerta, for example, is a brand name product, chances are there's gonna be some type of support program. So for me, I'm fortunate, I have very strong one-on-one relationships with a lot of these drug reps. So Concerta, for example, so first you should be applying for special support with the drug plan. Every Saskatchewan resident should apply because they look at how much your monthly medication costs as a family unit, and they also look at income. And it's not necessarily... and we say income, and I mean income from either your notice of assessment taxable income, or if you don't file taxes, they look at T4s or bank statements, what goes into from EI or CPP or something like that. So first of all Saskatchewan people should do that because, it helps huge when your medications are high cost, so medications like Concerta. Second of all, Concerta, for example, has coverage cards that are available to provide at no cost. And they have support programs that you can register your patient for, and then it gets covered 100% for 6 months to a year. And then we reassess you, and then it will continue until maybe, the government or your healthcare card or your third-party insurance provider here locally is able to continue providing that support. So I think, we're really good at that here.
is that a secret? Is it like, why isn't this a known thing?
It is. It's not a secret. It's, again, part of that integration and workflow. And the time that it takes for somebody to sort of suss this out sometimes can be, I mean, it's not like sometimes a minuscule feat. It can take a couple hours out of your day. And as a pharmacist and like a high volume place, people just unfortunately don't have the time. But here, we just make the time. That's part of our job. That's part of us facilitating the financial piece of the puzzle for the client and the relationships that we have built with the drug reps. If I don't know, they will find out for me, right? So that's kind of the nice piece of the puzzle is then I don't have to do the digging. It saves me the time, but I've built the relationship with the person that can do the digging for me, right? So so there's a lot of medication coverage costs. For example, we do injections. 2 primary injections I can think of. One costs $526.72 a month. The other one anywhere from $300 to $1,700. I mean, could you imagine trying to tell somebody out of pocket, I'm sorry, your charge is $756? I mean, they'd tell me where to go, right? So it's, again, navigating the system, getting the coverage.
Especially someone with a mental health issue, telling them that this is now going to be $1,700 a month. Aye.
And then our job is to just sort of reassure them, it's okay. There is no out of pocket expense for you. You just need to show up, come get your injection. Don't worry about anything else. And I think that provides a lot of relief and comfort for people. But if they see the drug, that heightened level of anxiety comes up. Well, I don't have any coverage, or my job has a cap on how much per year, like $2,000 a year. And you're like, oh, sorry, that's like one injection if you're on the $1,700 one, right? But it's just, no, don't worry about that. We've got it under control. Just show up. Let's get you well.
That's amazing. So my entire family has a $500 cap a year. And I mean, I blew through that in 2 months.
Yep.
Because Concerta is not my only prescription. So I was like, so then I felt guilty that I'm like, now if my kids get sick, it was like, talk about a spiral. And then, so what I did is I went and complained on Facebook, which is usually what happens when I'm like, I need help. Like, I don't know does somebody have some advice? And within 6 hours or something, I was covered for a year because someone said, call this phone number. And I was like, why is this not a thing? Why doesn't everyone know about this?
It's challenging too, even in like drug companies, like they have different programs under like the same drug company. So you can have like one company and it covers like 5 different drugs, but to get drug coverage for each of those 5 drugs, it's a whole different process, and it's a challenge to try to navigate. There's no like consistency across the board. I know the United States has this, but they have like websites dedicated to this particular issue where patient support programs, it's like literally let's type in the drug and see what type of patient support programs are available. They have that. Canada, we don't have that for some reason. I'm trying to advocate to develop something to get this in play because patients should have access. And the reality is it is so challenging, they just don't. And I just think of rural and remote communities. Like, they're just up the creek, as sad as that is, right? Because drug reps don't go to, the middle of nowhere, Saskatchewan, unfortunately, but mental illness does not discriminate. And no matter what province, territory, town, city, I mean, we have people there living with these illnesses. And the fact that they just go unsupported is terrible. There should just be one umbrella entity that's easy to use. And boom, Concerta number, call this, here you go. Bam, done.
I do have a fair chunk of my listeners are American. So, and people don't realize on Facebook that I'm Canadian. So then I was getting a bunch of advice from Americans. I'm like, well, this doesn't help. But so I did call the Saskatchewan drug plan thing because my pharmacist said, because I'm already on it. And she said, well, because you're on this new med, maybe you can, they can reevaluate your situation. What a pain in the ass.
Well, the pharmacist should be doing that for you. So I'm going to shake my finger to that pharmacist because we can just call and get that reassessed done on the spot.
Well, she mentioned that today, actually. She's like, I can look into that for you. I was like, oh, well, I already did, but it doesn't matter. But anyway, I sat on hold for like 45 minutes. They made me leave a voicemail. They said, do not call back because you've now left a voicemail. I'm like, so I have no idea what's happening. And then like 3 weeks later, I got an email from them saying, we've re-looked at it and there's nothing we could do. when I called that number, it was seriously like 4 questions. I got a direct line to if I have any questions or anything, I have a direct line and a direct email to the person I talked to on the phone, and they're covering it 100% for a year. Like, I'm like, why, what, like, what the fuck? Why is the government making it so hard when the company itself that's making it, trying to make money, is saying, here, no, okay, great, no, okay, yeah, here, we'll just send it to you. And at first they were like, oh, you're in Saskatchewan. Oh, if you're on the Saskatchewan drug plan, it's covered 100%, Concerta. And then she's like, oh no, that's Manitoba. Sorry, it's Manitoba.
Just kidding.
I'm like, fuck. Yeah. I'm like, well, why is it like just next door to me?
3 hours
This is covered.
that
The
way.
province covers
Yeah.
it. And here it's $180 a month. It's just bananas. Anyway, you're doing God's work.
Trying
that was my
to.
rambling.
Trying to.
Well, actually, my pharmacist today, she's like, I don't even know if she knew about this number either. She's like, I got this fax and this card thing. Like, give me that phone number. I know other people that can benefit from this. So thank you.
You're saving lives too.
Oh, yeah. God, yeah. Are you kidding me?
Well done.
I do get a lot of emails and messages and stuff from people. Like, yeah, it's very nice.
Yeah.
But anyway, thank you, random person that gave me that phone number on Facebook. I believe they were from Yorkton.
Thank you, Yorkton.
Thank you. Anyway, I'm not asking you any questions. It's not all about me. Do you notice that? Okay, how am I trying to say? So I know mental illness and addictions does not discriminate, but people that have money can afford a certain amount of things. Like, do you notice your clientele is mostly
low socioeconomic status?
Yes.
Yes. Just based geographically where we're located, we're centralized in Regina. So we're sort of in our core area downtown, right across the street from the General Hospital, which is, I would say, the primary hospital here in Regina. So because of that, and that, like where we are situated in comparison to other services, that seems to be primarily my clientele. But in saying that, I know other pharmacies and have spoken to other pharmacies that have the same methadone and Suboxone client who might be of, I'll use the higher socioeconomic status, who are being treated, just different pharmacy type of idea. But yeah.
So you don't think, I don't know where I'm going with this.
No, I think, unfortunately, the reality is the lower socioeconomic status is bearing the brunt of this disease and this illness. But in saying that, it doesn't discriminate, and there are others out there who are living with it as well. The reality is, though, it just seems to be underprivileged and lower socioeconomic status people.
Right. Okay. Because I mean, heart disease doesn't discriminate either, but there aren't people homeless and in jail
over heart
because of their heart disease.
Yeah, you're right.
Right.
You are right.
Is there anything I missed that you feel passionately, or even not even passionately, that you just want to bring up about Vital in your services or mental health in general?
I guess for patients, it's just don't be afraid to advocate for your own health or your own well-being. And if something's wrong and you're not feeling good, don't necessarily leave it up to physicians. There's a lot of this old school mindset too, that it's like a pharmacist will ask, oh, do you want to be counseled on this? Or do you have any questions or information? And it's like, no, my doctor talked to me about that. And it gives me like the EBGBs, and I cringe every time somebody says that, because I just think, your physician is the diagnostician, and then the pharmacist, our expertise is drugs. So I just really want to encourage patients to really advocate for themselves. Talk to your pharmacist about the drugs. We do have the ability to provide very valuable patient care in a capacity that's very different from your physician. And the reality is, I mean, there's a paradigm shift across Canada. Alberta is about a decade ahead. They've been prescribing for a long time. Nova Scotia just jumped on board. Pharmacists can prescribe there. And I think within the next year, pharmacists in Saskatchewan will be able to prescribe. So meaning if there is a formal diagnosis attached to that particular patient, and that pharmacist feels comfortable with that particular diagnosis, whether that's, for me, schizophrenia, bipolar, depression, borderline personality disorder, whatever that mental illness is, that's sort of my niche. I'll be able to help facilitate prescribing for that, in addition to diabetes, etc. So just to really be open-minded to pharmacists and our role, because the landscape is changing, and hopefully we'll be able to reach more rural and remote Saskatchewan residents and provide care that they so desperately need and just don't have access to.
So does that happen to you often when you're filling out a prescription, you've known the client for a long time or whatever, and you're like, I feel as though this is not the right dosage or the right medication even, and you question the doctor and it's like, but your hands are tied?
Yeah, but I'll tell the patient. I'll just say, you know what, I've spoken to your physician. They want to keep this as is. If you were my family member, this is what I would like to see. I'm not the physician and I'm not the diagnostician, so maybe there's a piece of the puzzle that I'm missing, but I would advise them to maybe sometimes seek another opinion. If I truly, truly think it's wrong, I will advise them to seek another opinion, but sometimes it's just like watch and wait and try it and see. And, I just got it from a walk-in clinic. I see my family physician, so it depends on a unique situation. But I guess I'm not afraid to have that conversation with patients if I truly think that it's wrong. I mean, I just think if that's my family member, my mom, my child, my grandma, what would I do and what would I want for them? And I just would expect sort of the same courtesy. So that's what I did.
Have you ever pissed off a doctor?
Oh, yeah. But you know what? No skin off my back. That doesn't even... See, yeah, you know what? Like, that I could talk about for a really long time also, right? So I'm just really lucky that in my environment right now, we all work so closely together. I text them. It's so nice. I don't have to necessarily always fax and wait, that these guys are now in my cell phone, that I can just text and get immediate responses. And it's almost like they know now, like Vital Care, they're calling me with a reason. It's not sort of something maybe minute that can wait, that is a fax that they should be sending me a fax request for. I think we're the only profession that still uses a fax machine. Like, that's just also really terrible. But I mean, they know we're calling for a purpose and a reason. And I think that's really wonderful to see, because then they respond and it's just sort of a really collaborative environment. And everybody like works together. We all just want the best. So it's so nice. I'm so lucky.
Thank you so much for that, Lindsey. Keep up the good work. I think what you're doing is really, really amazing, and everyone could use an advocate like you on their side, because you really do have clients' needs a top priority. So thank you for that. And if you want to visit Lindsey, the address to Vital Care Pharmacy is 1550 14th Avenue in Regina. You can also email them at vitalcare@sasktel.net, and you can also find them on Facebook, and I'll put all that stuff in the show notes so you can check that out. And please feel free to follow Bunny Hugs and Mental Health Podcast on social media. You can, on Facebook, it's Bunny Hugs and Mental Health. On Instagram, Bunny Hugs Podcast. And on TikTok, Bunny Hugs Podcast. And there's a lot more than just podcast stuff on there. There's memes and silly pictures and, well, podcast stuff as well. But, little clips and videos of my guests. You can actually see what they look like on the videos, and feel free to share and like and all that stuff on that stuff too. Please feel free to listen to next week's episode, and if this is kind of new to you, please go back in the library and listen to a whole bunch of episodes. I've got over 100 of them now, so feel free to go back and listen to those. You can share those, you can start conversations and stuff on Facebook and on Instagram about different episodes and different guests I've had. And please check out next week's episode and the ones following that, because I'm telling you, I've got some very, very incredible guests coming up. Some of them I've already recorded with, some of them I'm just lining up the interviews. But anyway, until next time, this is Todd Runnebaum saying, please remember to make your beds and take your meds. Bye.